I'm Dr. Aarti Campo, cardiologist with New Vance Health, and today I have with me Ann Lucas, nurse practitioner in the cardiology team at the Heart Center, who has a doctorate in nursing practice. She's going to talk to us today about palpitations. It's a very common symptom that affects a lot of people, and as this is Heart Health Month, Women's Health Month, we'd like to discuss topics that are pertinent to women's health, but also to the general population. Ann, can you tell us about palpitations? What are they?
Yes, hi, Dr. Campo. Palpitations are actually different for different people, but most commonly, people will describe palpitations as a sensation of feeling that their heart is beating strongly in their chest. They can also occur in the throat or in the neck. Sometimes it can be a rapid or very strong heartbeat, sometimes irregular. Typically, they last for a few seconds and go away, and they can come and go. And for some people, they're not particularly bothersome, but other people are very bothered by them. So we tend to see a lot of patients who come to us requesting evaluation of their palpitations that they're experiencing.
Now, what are some health factors that can affect palpitations?
A lot of different things. Things such as fatigue or sleeping poorly at night, dehydration, lack of exercise. Certainly stress can be a very large, play a large role for a lot of people. Anxiety can also contribute to this. Not uncommon when women are pregnant that they can experience palpitations because of the hormone changes going on with their body. There's some medications with stimulants in them, things like over-the-counter cold medications, and some asthma medications that can bring them on. And sometimes there's other underlying medical conditions such as thyroid disorders that can also cause people to experience palpitations.
Now, what should someone watch out for? If they're having palpitations, what are some symptoms that would suggest that maybe something more serious is going on?
So most palpitations shouldn't last longer than a few seconds. So if somebody's experiencing ongoing palpitations, something that's going on continuously for really greater than 30 seconds or a minute, that raises concern for a possible cardiac arrhythmia, which could potentially be something much more dangerous. You also want to look at the frequency, how often, if it's every day, if it's every hour that these are occurring, if it's something that's been going on for weeks, or if it's just once in a while that people experience it. And really what raises a red flag for us is if people experience symptoms like dizziness or lightheadedness or sensation like they're going to pass out when they're experiencing the palpitations. Also, any kind of palpitations where somebody's having chest pain, shortness of breath, or nausea with them are also concerning from a medical standpoint.
How would you test for palpitations? So let's say someone comes into you, they've been having palpitations, maybe with a little bit of dizziness. What is the testing available to us to evaluate this?
So first and foremost, we would want to do an EKG. That will show us the underlying cardiac rhythm that the patient has. Usually we'll check a blood pressure as well. Sometimes people can experience more palpitations if their blood pressure is running on the low side. If the EKG looks okay and the person's not experiencing palpitations at the time, we may want to do more in-depth testing, things like a heart monitor that the patient wears for 24 or 48 hours, also referred to as a Holter monitor. We typically would do an echocardiogram, which is an ultrasound of the heart. This will give us information if there's any kinds of abnormal structure changes with the heart itself that could be contributing to the palpitations, and certainly blood work. We would draw labs to evaluate for possible thyroid disorder, check blood sugar levels, check for anemia, dehydration, electrolyte changes as well.
Is there a way to treat these? If someone is having issues with palpitations or serious arrhythmias, are there treatments available?
So it depends on what we find in the workup. First and foremost, encouraging healthy behaviors with exercising, managing your stress, getting enough rest, avoiding caffeine, nicotine, and alcohol. Those are basic things that anybody can take to help control palpitations when we don't find anything that's concerning or alarming for people. If people continue to have palpitations, we don't find any kind of abnormal heart rhythm, then we could potentially do medications to help suppress the palpitations, but there's also side effects that can go along with these medications. Most importantly, we want to make sure that they're not having an abnormal heart rhythm such as atrial fibrillation, which can actually cause people to be at 5 times greater risk for having a stroke.
So if you could conclude the session today with what you think is a good takeaway from this, what would be your top 2 messages to everybody who is suffering from palpitations?
Be aware of when they're happening, how frequently they're happening, what the circumstances are, and how long they're lasting. If you have any of those symptoms to go along with them, lightheadedness, shortness of breath, chest pain, or if you're having palpitations that go on for a prolonged period of time, you need to see your provider and get checked out. That's first and foremost. And secondly, make sure you take care of yourself. Get enough rest, find a way to manage your stress, get exercise, and avoidance of triggers for it like caffeine and alcohol.
And thank you so much for your time today. This has been a great summary. Um, Thank you again. All righty. Bye-bye.
Bye-bye.